Balance Awareness Week is right around the corner, and one thing we should really talk about is a really common condition called BPPV. It stands for benign paroxysmal positional vertigo. It's not going to harm you. It happens suddenly with changes in position, and you get this false sensation of movement. For some people, the room just tends to shift. For others, it feels like everything's spinning. About 50% of patients who see their doctors for dizziness have BPPV, and even 1 in 10 people in the older population have this and don't even know it. Dizziness is never normal and should always be checked out by a medical professional. What BPPV deals with is this inner ear organ. It's attached to your cochlea, or your hearing organ, and you have a couple of sensory organs that tell your brain where you're moving in space and how to keep your eyes focused on a target. We've got these 2 small jelly bean organs that are sensors that are coated in jelly and covered in these crystals. Everybody has them, and they're very important. They tell us which way is up and which way is down. These crystals are similar to bone, and just like our bones, as we age, they can tend to degrade and break down over time. The problem is when they start to drop into these canals inappropriately. These canals are supposed to be like your accelerometers. They tell your brain where you're moving so your eyes can adjust and stay focused on a target. So sometimes these crystals might flake off these little jelly bean organs, and when you change positions, you can drop them into your canals, and when they move around in the canals, they inappropriately trigger the brain to think you're moving when you're really not. So one ear is telling your brain your head is moving, the other ear is going, no, we're not. And we end up with a really unique eye movement that makes the room look like it's spinning. All right, so we're gonna play a patient video. This patient is sitting on a table. His head is turned to the right and he's about to lie down flat. The initial eye movements you see are normal. It's him just laying down and tracking the ceiling. But watch what happens to his eye once those crystals start to move. We notice a very distinct pattern of movement that allows us to diagnose where the crystals are and which maneuver to perform. So if we're looking at the back of a patient's head, the inner ear organ sits at about a 45-degree angle. In order to start the treatment, we turn the head to the right, since this is the right ear. We'd have the patient lie down flat on the table. You can see this moves the crystals from the back portion of the canal to the middle portion of the canal. And since the crystals move, you will feel dizzy at that point. Once the dizziness stops, we wait an additional minute or 30 seconds. We turn the head about 90 degrees to the left. No movement of crystals, no dizziness. In the third position, we have the patient turn over onto their side with their nose facing down towards the mattress of the bed. At this point, the crystals move from the middle portion of the canal to the top portion of the canal, so that when the patient goes to sit up, the crystals are replaced and they're no longer dizzy. If you are having any sort of dizziness, even for a couple of seconds when changing in position, it's strongly recommended that you see your doctor or physical therapist who has knowledge and expertise in BPPV so that you can get diagnosis and treatment.